Thank you, Jed and Angela. It's an honor and a thrill to see many people that have also come all the way over to Arizona and made the journey the other way. But esteemed friends and colleagues, it's really a privilege to be here with you. Welcome from the U.S., where for some reason they seem to think they can solve issues in a town meeting. But I'm not so sure that that's the solution, but maybe we can have something of a discussion and a dialogue here about what recovery looks like. And I don't want you to be confused by me standing up here behind the lectern and you get some idea that I'm some kind of an expert. I just would like to say that really we all have expertise. And we can all contribute to something wonderful, I think, that is emerging together. And that's how we're going to do this. So I honor what you're creating and know that in many ways there's so much that we'll be able to learn from you. So I'm thrilled with the partnership. Let's see if I can find the right key here. Magic. Making recovery a reality, and I think Jed was telling us a little bit about changing the name. We really do believe that it is possible to put recovery into practice, but to do that, we're really going to create the future. And I think that's the theme of what my remarks are about, is that it's up to us. It's up to us to create something new and wonderful in the future. And we know it starts with a vision, doesn't it? So whether we're working with an individual that's come to us for services, whether we're an organization, whether we're a community, whether we're a country, or wherever we're coming from, we start with a dream. We start with some hopes. And it's a vision that is different than where we've been. So I was, this other subtitle here, We Changed Our Mind. I was sitting interviewing someone for a management position a couple weeks ago in a new project that we're about to get started in Washington State. And I was a bit triggered because his language didn't resonate with me. And you can imagine where he was coming from, and I think he was doing this because I would be impressed with how clever and smart he was. But he was talking about brains and chemistry and illness and disease. And I had to interrupt him because it wasn't working for me. And I said, Bill, we changed our mind. We have another point of view. Now, there was a guy that changed his mind and thought it was a good idea to spend 4 years of his life lying on a ceiling, lying on a floor, lying on a scaffold painting a ceiling, right? And Michelangelo said, I hope that I may always desire more than I can accomplish. He also said this, the greater danger for most of us lies not in setting our aim too high and falling short, but in setting our aim too low and achieving our mark. We've had low expectations. We can change our mind and raise the bar. Now, in the U.S., we were given a vision a few years ago in a report that the federal government did called Achieving Transforming Mental Health Services in America, Achieving the Promise. And there was a vision statement in this report, and when I read it, I was like amazed and a bit perplexed, actually, because the vision was really a big, big vision, and this is what they said. We envision a future when everyone with a mental illness will recover. How big is that? Everyone, not 90%, but everyone. And we have to understand something about what this word recover means. And we've had a lot of discussion about that. Sainsbury Center has been working on trying to detail and flesh that out. For us, what we've come to understand recovery to mean is simply this: remembering who you are, and using your strengths to be all you were meant to be. What happens to so many people when they get labeled with a mental illness is they forget who they are. And in fact, many times become that label. And so we hear people say, I'm a schizophrenic, I'm a bipolar, right? And our task is really to help people remember who they really are, who they were born to be, if you will, and then use those strengths, those gifts that they have to become all they were meant to be, and that's what we understand recovery to be. Now, the other thing I want to say about recovery that I didn't know when we first started having this discussion back in Arizona about, and in our organization, about what did recovery mean about 10 years ago, is that recovery is also for us. Recovery is also for me. Because there were certain beliefs that I had that didn't support people becoming all they were meant to be, right? And certain practices that we engaged in that in fact held people back. And in some cases even traumatized people. And I was the chairman of a provider organization that was responsible for all of the crisis and emergency services for our county of 3.5 million people. And when I started to listen to people and what they said about what it was like to be served by my services, sometimes what I heard didn't make me feel good. You know, they talked about being traumatized. They talked about violence. They talked about abuse. And in fact, sometimes some of the things that we did was something else they said they had to recover from. So in fact, I needed to recover too from some of the things that I believed to be true and thought were necessary. I think our system needs to recover as well. And I believe that it can, and I believe that there's hope for all of us. Now, we're in the midst of very tough times financially. I know for the last year in the States, there's been tremendous cuts, reductions, budget challenges, and it's put our whole mental health system in a real crisis. We provide services in North Carolina, in 5 or 6 different communities in North Carolina, and due to the budget crisis, the state decided that they had to right-size their budget and they had to reduce the mental health funding. And what did they do? They completely eliminated one of the important community service codes that we were billing under that was called community support. They have ACT teams, community support teams, and community support. $200 million worth of services gone that were supporting 36,000 people in the community. How do you deal with something like that? What's the solution to something like that? We were awarded a little opportunity in the city of Philadelphia, and I was talking with the Philadelphia leaders because the funding wasn't what we needed it to be, and they were explaining their situation, that the state was in such a budget crisis because of the economic challenges they were having that none of their provider organizations were getting paid, period. One organization, large major organization in Philadelphia, had just last week, when I was talking with them, cut everybody's salary by 30% in order to stay in business. We got a funding cut in Arizona programs of $500,000, which represents 10% of the outpatient and peer services that we deliver there. And I had to reduce executive salaries by 20%. We cut people's hours. We tried to do it in a way that was responsible, but these are tough times, you know. We do provide services in California. In the state of California, you may have heard about their budget crisis is sending out IOUs instead of checks, you know. What do? What's the solution? What's the answer? I have hope because the kinds of things that we're talking about now are the future and can offer a solution that can create real opportunity, I think, for recovery to grow.